Good afternoon. Today we are reporting an additional 261 Tulsa County residents who have tested positive for COVID-19, brings us to a cumulative total of 9,417 cases in Tulsa County. Good news is that over 8,000 of those cases have recovered, and currently a little over 1,300 are still considered active. Since our last press conference on July 3rd, 3 more Tulsa County residents have died from COVID-19, bringing our total to 101 lives lost. And as always, please remember to keep these families in your thoughts and in your prayers. I'd like to give you an overview from our data team of the majority of last month. The information I'm about to provide is from July 5th through July 25th. In that time period, there were 3,301 positive cases reported to Tulsa Health Department, averaging over 157 cases every day. More than 366 of those cases were in children under 18, representing over 11% of all cases for the month of July. 1,364 cases, or 41% of all cases, were young adults in the 18 to 35 age group. 733 cases, or 22% of all cases, were in the 36 to 49 age group, and 838, or 25% of all those cases, were in the age group 50 or older. Tulsa Health Department continues to provide specimen testing collection at 2 locations by appointment only. Those testing sites are our North Regional Health and Wellness Center at North 56 and Martin Luther King Boulevard, as well as a new South Tulsa location inside a former medical office near 101st and Memorial. Call our COVID call center at 918-582-9355 to schedule an appointment. Tulsa Health Department contracts with several public and private labs to run specimens tests on the specimen that we collect. At this time, we're able to provide results in 5 to 7 days, which, as you know, has been very much a fluid number. It's important to remember, if you are being tested for COVID-19, you should self-isolate while waiting on your test result, especially if you know you've been exposed. If you are exposed to a known positive case and you test negative, it's still important to stay home for the full duration of your 14-day quarantine, as the virus can develop within 2 to 14 days after exposure. In July, THD collected 3,850 specimens for testing at our testing sites. Additionally, we collected 642 specimens from high-risk settings. We pay very close attention to the percent positive rate, which provides insight into the instance of how the virus is spreading in the community. It's important to remember that there are many testing sites in Tulsa County. We are only able to report out the positive percent for the testing completed by THD. We're still awaiting results for 2 days last week, but at this time, our July specimens for the entire month were 19.59% positive, which is extremely high from where we were 2 months ago. So please remember, let's flatten that curve, let's get the daily positive counts down. Wear your mask, wash your hands, watch your distance. These actions, they do make a difference. We're also aware of many rumors and misconceptions about how cases are reported. In Tulsa County, all cases reported are unique individuals. That means that even if a person tests positive multiple times, they're only counted once. Tested individuals are assigned their own case number in the database surveillance system and will only be reported once, even though they continue to test positive. The CDC and Tulsa Health Department now recommend a symptom-based strategy for returning to work. Under this strategy, individuals may return to work when it has been at least 10 days after their symptoms began or after their specimen collection for testing if they were not symptomatic. It should be at least 10 days since symptoms first appeared and at least 24 hours with no fever, without fever-reducing medication, and symptoms have improved. I encourage businesses to review their company policies to ensure that employees who have had COVID-19 are able to return to work in a timely manner in accordance with CDC and THC guidelines. I want to thank everyone who continues to follow public health guidance by wearing a mask. New studies continue to show their effectiveness. Research from Florida Atlantic University's College of Engineering and Computer Science utilized a method to assess the effectiveness of face masks in abstracting droplets. Remember, masks are recommended to help prevent droplet spread from infected individuals. Results showed that loosely folded face masks and bandana-style coverings stop aerosolized respiratory droplets to some degree. However, well-fitted homemade masks with multiple layer of quilting fabric and off-the-shelf cone-style masks proved to be the most effective in reducing droplet spread. These masks were able to curtail the speed and range of the respiratory jet significantly. Importantly, uncovered emulated coughs were able to travel noticeably further than the currently recommended 6-foot distancing guideline. Without a mask, droplets travel more than 8 feet. With the bandana, they traveled 3 feet, 7 inches. With a folded cotton handkerchief, they traveled 1 foot, 3 inches. With a stitched quilting cotton mask, they traveled 2.5 inches. With a cone-style mask, droplets traveled about 8 inches. So these masks, they are effective. We've heard a lot about, I know parents are thinking so much about school and back to schools, and I want to acknowledge the challenging and monumental decisions of the Jenks and Tulsa Public School Boards yesterday for voting to begin the school virtually. We have no illusions that this was a difficult decision to make, as our local school systems try to balance the health and safety of their students, faculty, and staff with the essential role of learning and education. We support these courageous decisions to protect our school children, staff, and their families. Science should drive decision-making on safely reopening schools. At this time, with the case trends where they're at, it's our recommendation that schools follow this virtual model. On the subject of schools, the Oklahoma State Department of Health requires that children 2 months of age and older must present an immunization record or file for an exemption before they're allowed to attend child care or school in Oklahoma. Vaccines protect our children from vaccine-preventable diseases. It is imperative that parents continue to vaccinate their children according to the CDC recommended schedule. We will continue to support parents getting their children back to school ready. Clients seeking immunization services are encouraged to call Tulsa Health Department at 918-582-9355 to make an appointment. Again, we strongly encourage not to delay routine vaccines for your children and family during the pandemic. I can assure you that Tulsa Health Department and other healthcare providers are following local and CDC guidelines to keep you safe if you need inpatient care. Thank you for your time. I'd now like to introduce Tulsa Public Schools Superintendent, Dr. Deborah Giss.
Good afternoon, everyone. Dr. Dart, thank you so much for your leadership, for your consistent engagement in our work and your support and that of your staff, Ashley and others. It's truly been a partnership, and we're grateful for that. Last night, the Board of Education approved my recommendation that we begin our year in distance learning, and that they approved distance learning for those first 9 weeks. And what I want everyone in Tulsa to know is that we've been spending weeks this summer planning for 3 different possible scenarios. One scenario was the distance learning model, but I'll tell you, it was not until recently that we ever dreamed that that would be the one that we would recommend, and it's not the one that we wanted to recommend. We worked very hard on our in-person model and all of the things that would need to be in place to keep children and our team members safe. And we also worked really hard on a hybrid model that would have about 50% of our students in our schools at any given time. So it's not the one that we wanted to recommend, and I know that it's not the one that the board wanted to approve. But right now, the numbers and the spread that we have in our community right now makes that a necessity. And so right now, what we're going to do is we're going to do everything in our power to make sure that the experience that our families have in distance learning is stellar. It is not the same as what people experienced in the spring, and I think that's the most important takeaway. I also want to make sure that we do what Tulsans do, which is to come together to support our community. We're going to support our families. I'm going to ask other local employers, just as we will do for our employees, to make accommodations to support those who are the parents of, who are working parents of school-age children. And I'm also going to implore Tulsans to come together and follow the guidance that the Tulsa Health Department is giving us about staying safe, and for us all to wash our hands, wear our masks, and watch our distance. If we do that, what we have heard from the experts is that we can dramatically lower the incidence of this virus spreading and of people contracting this disease. And when we do that, we can get our students back in school. And I think that what we know right now is we have about 4 weeks until school starts, and then we have 9 weeks. So if we started today and we really worked hard, what Dr. Redfield at the CDC said is that 4 to 8 weeks we could see an absolute turnaround. So that would mean that we could be back potentially even in person and not even in hybrid for that second quarter. But it's going to take all of us doing what we need to do together. And I have confidence in Tulsa that we'll get that done. So, Mayor, I'm just so grateful for you, your team. You've also been incredible supporters of education and incredibly helpful to us during this difficult time. And I'm going to turn it over to you.
Well, first I want to thank Dr. Gist. As she mentioned, my team at the city has been working really closely with her team at Tulsa Public Schools. I've been in meetings with her, and I've seen the level of scrutiny that they've applied to this decision-making process, bringing in the best experts to advise them, and ultimately making a decision that's in the best interest of safety for kids in Tulsa. And as the parent of one of those kids, I'm just really appreciative. So thank you, Dr. Gist, and to the TPS School Board. A couple things related to that as we look ahead and think about our team at the city, many of whom are parents, and how this impacts their ability to serve the citizens of Tulsa. And in particular, we think about our crews that are out there, our first responders, our water crews and sewer crews and street crews. We want to make sure that we're providing them with the resources they need to continue both being great parents and doing what they've got to do for their kids, but also serving the citizens of Tulsa. And so we're making sure that all of our employees are aware of their Family and Medical Leave Act benefits provided by the Families First Coronavirus Response Act. We're allowing flexibility as to when their required furlough hours are taken. That's another thing to remember about the really selfless public servants that we have in the field at the city of Tulsa is over 1,000 of them are taking a reduction in pay right now so that we can continue to have fully staffed police and fire departments out there in the field protecting Tulsans. So our team at the city is really taking a great sacrifice to protect the citizens of Tulsa in the midst of all of this. We're also encouraging flexible work schedules when those are possible, and promoting remote work and flexible telecommuting options when those are feasible. So we're really evaluating a number of different things that we can be doing to help our employees. And then later this week, through Impact Tulsa, I'll be part of a group of local business leaders who are discussing within our own individual organizations what we are doing to help the parents within our organizations as we move through such an unprecedented time. Yesterday, we announced in partnership with Cities for Financial Empowerment a Financial Navigators program in Tulsa. There are a lot of people in the midst of this, both in the midst of a global pandemic, in the midst of a national recession, who are struggling to make ends meet. And to help combat the financial challenges brought on by this convergence of global and national events, the city has launched the Financial Navigator program to help triage residents and connect them with available financial resources. And the program comes at absolutely no cost to the participants. It's completely free for residents of the city of Tulsa. These navigators will provide over-the-phone guidance to help Tulsans identify immediate steps that they can take to manage expenses, to maximize their income, and get connected with other available resources that are out there. It's one of the great challenges that we see in this current environment. There are so many different resources that are out there, and these financial navigators are there to help connect individual Tulsans with them, very much like the financial navigators that we've had in place for small businesses in Tulsa since the outset of the pandemic, through our Resilience and Recovery Fund, have been able to do there. For anybody who wants to access this completely free service, you can visit the cityoftulsa.org COVID-19 page, or you can just call 211 and get connected with them. Lastly, although it is not COVID related, there's just been a lot of news this morning around the mural on Greenwood, and questions about my conversation with the Greenwood Chamber yesterday. Over the weekend, it was brought to my attention that the Greenwood Chamber had not really been properly engaged in knowing what their options were relative to keeping the mural in place. There were a lot of folks speaking up about the need to keep it, but the Greenwood Chamber owns the property on both sides of that street there, and they had not been properly engaged. I didn't think that it was appropriate for the city to move forward with removal of that mural first thing Monday morning, which is how it was scheduled, without having that conversation with them. And so I put a halt on it on Friday afternoon, and then reached out and visited both with the president of the chamber yesterday morning, but also the president of their Merchants and Tenants Association. The conversation, which I generally don't like to discuss private conversations, but since it's been called into question, I feel like I have to. I approached them basically just to let them know what their options were. That if they wanted to keep the mural, from our standpoint at the city, there were two main options that they had at their disposal. One, they could ask the city to vacate the street. And what that does is the city basically removes its responsibility for the street. It becomes the property of the property owners on either side of the street. If you have a house, your property line actually extends out into the middle line of that street. Same for any other business owner. And if the city all of a sudden removes its easement on that street, then that property is yours. And all of the issues around this mural are around the fact that it's public property that's being used as a public forum when there is no mechanism in place for other folks to be able to use it as a public forum. And so I told them, we can vacate it, we can move through that process, and they did not want to do that, and for understandable reasons. Usually when we vacate a piece of property, it's for a development project where they're going to build something on top of a street that hasn't been used in years. Or it's in a neighborhood where they're going to gate it and charge the homeowners a rate to maintain the street. But you don't see a lot of streets vacated where it's a general open thoroughfare that people are walking on and driving on, and they had concerns about legal liability and maintenance costs, and I completely understand those concerns. The other option that was at their disposal and remains at their disposal is to pursue a permit through the city council. The city council, under our charter, and this is one of those unique things. Usually the mayor has sole executive responsibility at the city. This is one that is only reserved for the city council. The mayor is not involved in the process. But the city council has the ability to issue a permit for the use of messaging on public property. And so I told them, about the council's meeting the previous week and the council's concern, and there had been a different proposal made for a Blue Lives Matter mural on a street, and the outcome of that discussion that the council had the previous week was if you allow one group to display a sign on a street, then under legal guidance, you have to pretty much allow any other message that's lawful to also go on streets if people apply for it. And I think the council, very rightfully, had concerns about opening up our streets in Tulsa to any kind of message that people might want to put on them. And so the council declined to move ahead with that request and really with any. But I wanted the Greenwood Chamber to know that if you're a property owner that owns both sides of the street and you're going forward and making this request, that the council might, or the council should, hear you out and hear your request and make their decision accordingly. They conveyed to me, that the leadership of the Greenwood Chamber and the Tenants Association, that they also did not want to do that, that they felt that it was that the message that's there is associated with a national political movement that not all people are on board with, and they did not think that it should be in the middle of a street. They also conveyed to me that they were upset with me for delaying the removal of the mural yesterday morning, and that they did not want to be in the middle of some big fight between activists and the legal team at the city over what we can do. So that ended the conversation. I thank them for their candor and conveyed to our team at the city that, seeing no other way to go forward, we would have to move forward with removal of the mural. I then reached out to leaders of our philanthropic community and talked with them about what other options we might have. Because I think most people I talk to think it's cool. I mean, it's a beautiful mural. It's just that it's on a public piece of property rather than on private property. If this was on the side of a building or the roof of a building, no one would be having this conversation at all. But the fact that it's on a public street is what makes it so complicated. Through conversations that occurred throughout the balance of yesterday, ended up talking with leadership from the Hilly Foundation, which happens to own both sides of Greenwood, just one block to the south. They indicated that they would like to move forward with seeking a permit from the council to put a mural on that street. And so I conveyed that to Councilor McKee, whose district is represented in that area, who would be the lead on something like that coming before the council. And she was going to follow up with her colleagues on the council. And that's really where that conversation left off in the latter part of yesterday. I assume that is moving forward, but again, it's a matter before the council at this point. What I would say, having heard, I didn't get to see, but having heard about some of the comments that the president of the Greenwood Chamber made today, is, if they want the mural there, the options to keep it there remain at their disposal. They can still seek the permit from the council. They can still request a vacating of the street. Now, I imagine vacating of the street, for the reasons they told me yesterday, is not legal or financially feasible for a private organization. That's totally understandable. But seeking that permit application from the city council remains absolutely at their disposal. So if they want it, they can seek it. So I would strongly encourage them that if they want to keep it there, to contact Councilor McKee, whose district that's in, and let her know that they want the council to consider a permit application. But if we don't receive guidance, and that's the other question I've had, if it was put out over a month ago, why is it still there? It's still there because I wanted the council to have the ability to deliberate on this and make a decision. But we cannot just draw it out forever, primarily for legal reasons. We cannot use a city street as a public forum for one group and not allow other city streets to be used by other groups. And that's the legal challenge that we're in at the moment, so long as that is there without a permit issued by the council. So if the Greenwood Chamber wants it there, they are free to seek that permit from the council. If they don't, and if the council doesn't approve that, then we have to remove it. It's not a matter of disliking the message. I think it is a beautiful mural. The message is important, especially in this era. and it's important in that place, in that space in particular, for everything that Greenwood means to Tulsa. But we have to have some legal process that allows it to go there and allows others that would want to have messages displayed do so. Short of that, we cannot have any messages on city streets. So I just wanted to clear all that up because I'm sure everybody, all the reporters in here have questions about that. I wanted you to understand, at least from my vantage point. And again, just to bring all of this full circle, I want to thank everyone for wearing your masks. I continue to see them in high numbers out around town. Continue to have people thank me, especially I've talked to a lot of senior citizens who feel safer out and about in Tulsa, who are grateful that we have these, and that more people are taking this seriously. And we're going to continue to monitor the numbers on this. The council and I had a really good discussion late last week with Dr. Dart about the numbers and how they look and how trends are looking. We will continue to have those discussions and monitor it and respond as we need to keep Tulsans safe. Thank you very much.
The mayor, have you stay here. We're going to take COVID-related questions now in respect for our other speakers and the time we have. But if you do have real questions, you can get with me afterward. But for now, we're going to just take COVID-related questions, and we'll start with the mayor.
Mayor, are you surprised that the mask issue is a issue on the campaign trail? You're 50 feet south from the big vote. Are you surprised that the mask mandate is an issue at all?
The question is, am I surprised that the mask issue is an issue on the campaign trail? No. I mean, it's election season. Everything is an issue in election season. And the reality is that there are some folks out there that still aren't convinced that these are necessary or useful, in spite of all the requests from our local hospitals, the guidance from our local doctors, the guidance from the PhD in public health who runs our health department. And so I don't know what else, just from a practical standpoint, we can do. You heard Dr. Dart talking about the different kinds of masks and their proven ability to restrict droplets from moving forward and how important that is. But no, to your question, am I surprised that it's an issue on the campaign trail? No. I think that in an election season, especially running against an incumbent in a historically challenging year, people who want to win are going to use every opportunity that they get to try and make an issue of things.
Mayor, what metric are you or the city using to determine whether or not you can roll back the mask mandate or whether or not more needs to be put in place?
So the question is, what metric are we using to determine when we could roll back a mask mandate or if we need to do anything else? I can speak for myself. I wouldn't take the presumption of speaking on behalf of my colleagues on the council. The number one thing I'm looking at is hospitalizations. And the reason for that is a hospitalization on any given day is certain and clear. We know if someone who's positive with COVID is in a hospital or not. The challenge that we have with the daily case counts that are reported is that those are not it's not like everybody that gets reported today was tested yesterday and got their results back in 10 minutes, and that's the answers that were being given. I saw a report last week from the state on one day that the results that were being reported, over 30% of them were from tests that were administered more than a week before. And so it's useful from tracking an overall arc and trend. And you look at our positive case rate over the last 2 months, and you definitely see an overall arc and trend. But from a day-to-day measurement of how we're doing, it is not a reliable metric. The most reliable one, in my opinion, is hospitalizations, because it's very clear-cut. Now, the challenge with that is it's also not a leading indicator, By the time somebody is hospitalized, generally they've had it for a while, and so you're not going to see early trends developed by tracking hospitalizations. But from a day-to-day standpoint, it's the most, I think, the most valuable in seeing how we're doing as a community.
Mayor, last week we talked about that White House report that had some pretty strict recommendations for Tulsa County, and you
Yes.
said you'd be very concerned if the governor got that and didn't share it with you. The governor's office has confirmed they're getting those White House reports and they're not going to share them with local governments. So are you going to take any action to try to persuade the governor otherwise?
Well, I hadn't heard that they are refusing to share them with local governments. I know that's a disappointment if that's accurate. I will say that the council and I did have or members of the council and I, not the council in its entirety, members of the council and I had a conversation about those recommendations with Dr. Dart. I would love it if you wouldn't mind if he'd be willing to speak on his thoughts on those recommendations. And the key thing to remember about that report, you know, when we were talking a week ago, I didn't even know if it was legitimately from the White House. Now it's been confirmed that it is. But it is also using metrics to make broad sweeping prescriptions for cities all across the country rather than looking at the data on the ground. And that's where it's really valuable for us to have the Tulsa Health Department doing the contact tracing program that they are and seeing what the real causes of issues are in Tulsa. So I would love it if Dr. Dart would address your question as well when he's up here.
Any other questions?
There was a report, I want to say, to City Council, I want to say late April, early May, where the city had come to an agreement with AT&T and Cox to provide internet service where it had been cut off. Is there an agreement in place to keep the internet on for folks who have fallen behind so their kids can stay in school?
So the question is about internet service providers, and are they still providing service for those who aren't able to pay? Like you remember in the early going of the pandemic, a number of our utilities, including Tulsa Water and Sewer, PSO, AT&T, Cox, ONG, a number of them stepped up and said, we're going to put a moratorium on cutting off service while we get through the early stages of this. I couldn't tell you today if AT&T and Cox are still doing that or not. I do know that we have an internet access task force that is made up of people from my team at the city who've been working with Dr. Gist's team at Tulsa Public Schools. And I think we're going to have some announcements around that here in the next couple weeks to make sure that any kids in Tulsa that need to engage in distance learning have the resources and the ability to do so.
Yeah, I was curious about the adoption of masks. So
The what?
the adoption.
Oh,
adoption
yeah.
of the mandate. Last week, Dr. Deborah sort of said the positivity rate would be a good indicator whether or not masks are working. And as Mr. Dart said earlier, we were at almost a staggering 20% for the month of July. On a more granular level, are we seeing, and this might be for start, are we seeing a downward trend in the positivity rate toward the end of July? And how does that speak towards the efficacy of the mask? Is it because not enough people are wearing it, or because they're not effective?
So the question was about trend data that we saw through July that showed a significant increase in positive cases, and are we seeing, after the adoption of a mask ordinance in Tulsa, any sort of corresponding decrease in positive cases or anything that would indicate that it's making an impact? First, I would say the increase that we saw over the month of July is one of the key reasons that the hospitals contacted us and said that we need you to put this in place. And not just positive cases, but hospitalizations correspondingly went up substantially in the month of July. And that's why we adopted the mask ordinance that we did, because the hospitals pointed out to us that on the trajectory that we were on, that it was not sustainable if we didn't change something. And given all of the options that were out there at our disposal or at the state's disposal, there are a lot of things that would have been very harmful to the local economy. Closure of businesses or another moratorium on elective surgeries. Those are a couple of the other options. But the mask ordinance was by far the least invasive of all of those options, and it's one of the reasons that we decided to implement it. Now, as far as overall trends that we've seen since the mask ordinance went in place and what impact that's having, I would defer to Dr. Dart. I look at the data, but he actually has a PhD in this stuff, so I would like to hear his thoughts on what he's seeing there. One thing he did caution the council and I about in the early going of this, though, was any mitigation measure that you put in place, it's going to take a while to see the impact of it in the data because you're slowing the spread rate. But one, there's a lag in just the overall adoption of it. Everyone in Tulsa didn't wake up the morning after the council adopted that ordinance and don a mask. It took a little while, but I think every week that I've seen since we've put that in place, I see more people wearing them. But also just from an overall contagion standpoint, it takes time to see that borne out in the data. So I would defer to him as far as any specific data points that his team might be seeing on that as well. All right, thank you all very much.
Do we have any questions for Dr. Giz?
Yes. When you mentioned that distance learning is different from virtual learning, can you lay that out a little bit for us?
Absolutely. So what I was actually referring to is that distance learning, the experience that our families will have and our children will have and our teachers in this first 9 weeks of this school year is different from the experience that they had in the spring. And there are lots of reasons for that, but I want to make sure to reflect back on what happened in the spring. Our teachers and kids went home for spring break and they never came back. They left, the buildings were closed, people were not allowed in buildings. So in many cases, they didn't even have the materials that they teach with. So they were really just doing what they do best, which is to rally and to make magic out of nothing. But that is not the best way to work. And so while so many of our team did a remarkable job, it wasn't as good of a job as they deserve to be able to do with the tools and professional development that we're going to provide for them. So there are lots of ways that this year are going to be different. People can go to tulsaschools.org/back-to-school to find out more, including there are videos where I'm having conversations with our teaching and learning specialists and things like that. So there's lots of information that's out there to explain how it will be different. The other thing, though, that I would point out is that Tulsa Public Schools is offering a virtual academy, the Tulsa Virtual Academy. And if you imagine that if we were going back in our hybrid model or our in-person model, which we wanted to do, and we had our virtual academy as an option for families, because it's an option for families, it would have made a lot of sense to everyone. But you can imagine how it would be confusing when we're offering the virtual academy still, but we are going to be in distance learning for the first 9 weeks. And so we also want to help families understand the difference between those two. One is that the virtual academy, you're signing up for the whole semester. So if it's a family who says, listen, if I found out that we were going back that second quarter, I would be so thrilled, because our goal is to be back in school as soon as possible, and we have confidence that the superintendent is going to work with Dr. Dart, and we're going to use the best information, and that's what we want. If it's a family who says, you know what, if they decide to go back that second quarter, I don't think I'm going to be comfortable with that, then they're going to want to sign up for our virtual academy, because our goal is to get back as soon as we can. There are a few other differences that have to do with, in the virtual academy, it's much more self-paced and things like that. But again, if people go to tulsaschools.org/back-to-school or specifically for the Tulsa Virtual Academy, they can go to tulsaschools.org/virtual to get more information. And the deadline to sign up for the Virtual Academy is August the 10th. I'm going to be having a couple of like Facebook Live and Zoom calls for people to help them make that decision between the Virtual Academy or our distance learning model.
Some districts have been looking into rapid testing for their teachers, even though they're doing distance learning and things like that. Is GPS looking at a contractor for that, just to get you quick results back?
No, we're very concerned about testing, but in our conversations with the experts, there are still, this is really a question for Dr. Dart, but there are still concerns about the, what would you say, the accuracy of the rapid tests. And while we hope that that will change, that the science behind those rapid tests will improve, right now they're providing too many false positives or false negatives, and so that's not something we're looking into right now. We are very concerned about testing and the backlog in testing right now, because from a staffing perspective, being on distance learning, we'll be able to manage it. But in trying to get back to school, if we don't resolve that problem by then we have this ongoing issue around having enough people to function in our school district, whether it's bus drivers or custodians or teacher assistants or clerks or teachers or school leaders, because people wouldn't be able to be at work even if they're not having symptoms, if they tested positive, or even if they just had an exposure, if we can't get a test back quickly. So we need that issue resolved before we can get back to school as well.
Any other questions for Dr. Good?
My last question for you would be, have you all come up with a school lunch plan yet? Is that going to be very similar to the spring?
Yes, so we will continue with our distribution so that families can come and pick up meals, and we'll also continue with our bus routes where we're delivering meals into neighborhoods.
One more question for Maureen.
I know obviously this is a difficult decision for y'all, but we're also thinking, I know families who kind of rely on sending their kids to school so they can work. Are you guys providing any kind of help for those families, especially for those people who need to do their job, but they also are now kind of becoming teachers as well?
Yeah, so the question is about the impact that this recommendation and the vote of the board last night has on families. And I'll tell you, there are many, many reasons why this was not the recommendation that we wanted to make to the Board of Education, and the impact on families was a huge one. We know that people rely on our schools not only for their children to have a great educational experience, but also because it's how our society functions. We're used to school-age children being in school while families carry on with their lives and do their work and everything that they do to be able to maintain their home and provide a quality of life for their children. So the answer to the question, which is there any concern about that, but also is there anything that we're doing? The answer is yes. And so we are working right now with a number of different community organizations, particularly the Tulsa Area United Way, the Opportunity Project, and Impact Tulsa. And then we'll be working with organizations throughout the city, those that people would know, the YMCA, Dream Center, and so forth, but also organizations like faith-based entities and things like that, to provide safe places for children to engage in their learning while their families are working. This is not a recreation of school, because if we were going to recreate school, then we may as well be in school. So we're talking about much smaller groups and so forth. So we're working right now on that, and it's something that we're really partnering with, but this is an example of where this is Tulsans stepping up to support families. I would also just again implore the business community to provide flexibility and support for parents of school-age children, for hourly employees to help them manage their hours so that they can try to make this work. Perhaps they're collaborating with another family or their spouse or someone from their church or whatnot, and they need flexibility to make those hours work. or if there's someone whose job allows them to work from home at least some of the time. Those are the kind of flexibilities that we would love to see. I would also make a further request to say if businesses can provide on-site care for children during the day, just a quiet place with internet access for children to be able to engage in their learning. As the second largest employer in Tulsa County, we are looking at the possibility of providing care for the many employees of ours, bus drivers, our custodians, and others, to be able to have a place for their children, because they can't do their jobs while their children are at home either.
Thank you, Dr. Dick.
Mhm.
We'll end with Dr. Dart.
Dr. Dart, can you give us, do you have any outlooks about flu season? Because it seems like the flu has similar symptoms to COVID, and we're going to be having people coughing and wondering what they've got here pretty soon.
So the question was whether we had any outlook over the flu season, and frankly, we don't yet. You know, we track it in the southern hemisphere before it comes up, so we know it's circulating, and how that's going to how we're going to address both influenza and COVID this fall. Well, we know this fall more than likely we will not have a COVID vaccine. We will have influenza vaccine, and we will do what we do normally and ensure that everyone who needs it gets an influenza shot. And of course, the good thing about that is that so many other outlets also give influenza vaccine, so there shouldn't be any shortage in vaccine at all.
Dr. Dart, you mentioned the number of positive percentage, but how are we doing just kind of as a county right now when it comes to this COVID? Because they're already talking about the second wave in the fall. You know, what are we looking at right now?
So the question really was, how are we doing with COVID in Tulsa County this fall? And I want to remind you that the percent positive I gave was just from our pods. That wouldn't that doesn't account for all the Tulsa County testing. Our pods, of course, I think we see the most at-risk people in our pods. So we expect it to be higher now. Almost 20% is much higher than what we would like. But it's important that we do that testing. We understand the incidence and prevalence of COVID-19 in our county, so we can actually track it when we look at mitigation. And more importantly, to help inform vaccine strategy when we do have a vaccine. So, you know, I think we mirror a lot that's going on all over the country. We have widespread virus in the county. Just like everyone else does. We're doing our best to really understand how well it's transmitting, how well it's circulating, so that when we do have, and we're already planning for vaccine strategy now. What we don't know with the vaccine strategy is that will that be a prioritized list like it was with H1N1 10 years ago when the most at risk got it first, and I'm assuming we'll have a strategy similar to that, but we'll have to wait and see. They have started those conversations on the federal level, and hopefully they'll involve us at the local level as we go forward.
Dr. Dart, we've had a few days from the State Department of Health reporting new cases at relatively low levels. Do we know if those numbers are accurate reflections of where we are as a state, and is that reflected in Tulsa County? And is there anything to do with the backlog of testing that we keep hearing about?
So the question is about the numbers that we're receiving and the things that impact those numbers. And definitely the backlog in testing has impacted those numbers. And we're still trying to figure out, as we get results going forward, are those results within that, hopefully, a 5 to 7 day time frame, or is it even further? And if it's even further, then we know the results are somewhat dated, which impacts our ability to do contact tracing. It impacts our ability to mitigate spread. So, you know, as laboratories, I think they are, to use the word, they're swamped. And there's also been a shortage in reagent cartridges like we experienced back in March and early on in this process. So, but they are catching up. And so I think hopefully within the next 7-10 days, we'll have a much more accurate reflection of those case numbers, and are they current? Are they within five days of that test being taken, so that we can actually get on contact tracing and do it more quickly? And plus, we'll have a much better feel. We look at 4, 7, and 14-day rolling averages. That's an accurate reflection of the trend and the patterns in the community. Right now, because of delay in reporting, we're not truly sure.
Dr. Dart, can you speak on schools and what kind of vector for transmission they are?
So the questions are on schools and what kind of vector for transmission, and frankly, it's not really the school itself. It's just that everybody coming together in one enclosed spot, and that's where potential for transmission takes place. And right now, with virus circulating as effectively as it is, putting anyone in a room where you're not able to socially distance as well as you should, and wearing a mask is difficult when it comes to children. It just increases the potential risk for transmission. So, that's what we've been saying about really large any kind of indoor gatherings, is that if you're there and you're not able to mask, you're not able to physically distance, then risk, of course, goes up with that type of event. So, are schools a potential risk? Absolutely, especially with the data that we're following right now.
Can I follow up on that really quick? Is THD reaching out to the school districts within Tulsa County who are choosing to reopen in person? Like Broken Arrow and a few others.
So the question was, are we reaching out to all the school districts? And yes, we are. Matter of fact, one of our staff members who reviewing all the safety plans reached out to Broken Arrow this morning. I have no idea if they have heard back, but we've tried our best to engage all the school districts and be a part of, and however they want us to be, their decision-making process. We can't go in and tell them what to do, but we try and recommend and give them guidance and use science to give them the best alternatives possible as they go forward.
Are you trying to change their mind?
At this juncture, our perspective is that right now, virtual learning is the safest route possible. So that's our stance, and that's our recommendation. Now, 4, 5, 6 weeks, hopefully that's going to change because everyone's wearing a mask and we're starting to flatten the curve.
One last question?
Could you speak on the positivity rate that I asked
So the question about the positivity rate, and as I mentioned earlier, that's reflective of just the 3,900 tests that we did in our pods for the month of July, which we know are more than likely a higher risk patient. So we're not surprised to see a high percent daily positive in those pods, but 20% is much higher than we would like. It tells us that we do have very efficient transmission going on in the community. And speaking to other testing sites, their positivity rates have somewhere in that halfway point as well. So we're still seeing positivity rates that are too high than we would like. And hopefully once the state and the laboratories catch up and we get our data reports, we'll start to see an accurate reflection of what our trends truly are. Right now, because of the lag in reporting, it's a little up and down, so we don't know if it's because we're actually mitigating virus, which we're trying very hard to do, or is there a delay in reports.
Great. Thank you all.
Thank you.